Thanks for joining us for a special web exclusive Q&A. All month long, we've been raising awareness for breast cancer. While the month is nearing an end, our mission isn't over. We're taking it a step further tonight. We know more than 280,000 women will likely be diagnosed with breast cancer this year. That's according to the American Cancer Society. So tonight we'll be discussing the most commonly asked questions about breast cancer. Two medical experts practicing in North Alabama are joining me here tonight. First, we have Dr. Beth Falkenberg. She's a radiation oncologist and Huntsville native. She's worked at Alliance Cancer Care since 2005. During her residency at the University of Alabama at Birmingham, she was part of research involving different types of radiation therapy and also a study on malignant metastatic brain tumors. Dr. Rebecca Ullman, also here this evening. She's a general surgeon who specializes in breast surgical oncology at the Huntsville Hospital Clinic for Breast Care. Before she started working in the Rocket City, she completed medical school at the University of Tennessee Health Science Center. Thank you both for being here this evening. Before we dive into answering the most common questions about breast cancer, we want to invite you to call in with your own questions. We have the phone number right there on the screen right now and are standing by to take your calls. When your call is answered, be prepared to give your name and question. You'll then be asked to stay on the line until it's your turn to ask either Dr. Falkenberg or Dr. Ullman your question. We'll also have the phone number running across the bottom of your screen in case you miss it. All right, now let's start with exactly what breast cancer is and how it impacts the body. Dr. Falkenberg, would you like to explain?
Breast cancer is a cancer that starts in the breast, and the cancer can metastasize to other places such as the lymph nodes or other portions of the body. But the majority of the time, breast cancer is caught early because of screening mammograms and the availability of mammograms. As far as breast cancer, we suggest that patients seek care from their primary doctor and try to undergo yearly screening mammograms.
Dr. Falkenberg, thanks for that. Now, being diagnosed with cancer, as you know, can lead to a lot of anxiety over how it happened, right? Dr. Ullman, one of the questions you're most asked is, what caused my breast cancer? Did I do something wrong?
That's right, Nakell. So a lot of times women feel guilty or concerned that they did something wrong to develop breast cancer. And I just want to let the ladies out there know you didn't do anything wrong. We're still learning a lot, science is still advancing, and we're trying to figure out what causes breast cancer. Sometimes we know it's something like a specific genetic mutation that occurs in families. Other times it's something in the environment that you're exposed to. Sometimes it's something that's passed down through families and we still don't understand the gene that drives that or what exactly is going on in that family. We still have a lot of unknowns, unfortunately, so one of the best things you can do for yourself is get your annual screening mammogram and talk to your doctor about your risk for breast cancer.
All right, Dr. Ullman, thanks. This question is for Dr. Falkenberg. My pathology report says invasive ductal carcinoma. What does that mean?
So there are multiple types of breast cancer, but invasive ductal carcinoma is the most common type of breast cancer. The other type is invasive lobular carcinoma. So asking your doctor about the pathology report and what other options you have. Some patients have estrogen positive cancer and some have estrogen negative cancer. The pathology report can be very complicated, so make sure to go over it with your physician.
Dr. Ullman, thank you. Earlier this week, I sat down with a staff physician from the Alabama Women's Wellness Center, where they specialize in obstetrics and gynecology. Here's Dr. Sanithia Williams Cheatham answer to a question. Can I lower my risk for breast cancer?
Our age is not modifiable. Race and ethnicity, which also can contribute, are not modifiable, but increasing exercise, healthy balanced diet like we talked about in terms of limiting processed food can definitely modify your risk. Quitting smoking, if you're a smoker, that can lower your risk as well. there are some things that, in terms of prevention, there's only so much you can do. So the other part of that is the early detection that you talked about. And so making sure that you are detecting a breast cancer as early as possible.
We'll hear from Dr. Williams Cheatham later in our Q&A session about the risk and benefits of breast cancer screenings. I'm sure this next question is one that may be a surprise to some of our WAAY 31 viewers. Dr. Ullman, can men get breast cancer?
To many people's surprise, men actually can get breast cancer. They represent less than 1% of cases of breast cancer and oftentimes have a genetic predisposition for it that runs in the family. But we definitely want to let the men out there know that you need to be breast aware just as much as the women in your life. And we encourage you that if you notice any changes to your chest, your breast tissue, such as lumps or skin changes, that you go and see your doctor and get checked as well.
All right, Dr. Ullman, thank you for that so much. So I have a question as it pertains to men. What's the difference in terms of how a man can tell if they have a lump or a cyst and when women detect a lump or cyst in their breast?
Actually, it's pretty similar. So for women, a lot of times they are able to detect a mass in their breast when it's a little bit larger, depending on how large their breast is. Because women tend to have more breast tissue than men, sometimes the mass has to get a little bit larger for them to detect it. For men, because they tend to have less breast tissue, they might feel a lump sooner than a woman would, depending on the size.
Most people want to know if they do detect a lump, in their breast, what exactly should they do?
I want to encourage all women, if they notice changes to their breasts, that they should see their doctor as soon as possible. Sometimes women are told that it's just their age or their weight or hormonal changes, but it's always better to be checked and to have testing done, which typically includes a mammogram to get started with.
Okay. Thank you, Dr. Ullman. Going off what you said, Dr. Falkenberg, is there any way women and men, can really be more cautious or be more aware of the condition of their breast so that they can possibly detect if there's anything abnormal happening?
Yes, I think it's excellent to be breast aware. And so if there's a change when you look in the mirror and you notice maybe there's nipple inversion or there's a slight shadowing or change, I think that's the most important aspect of it. We don't always expect everyone to do a monthly self-exam, but mainly be breast aware.
The American Cancer Society recommends, as you both know, annual mammograms for women ages 45 to 54, with optional mammograms starting at age 40. But Dr. Williams Cheatham advises women as young as 20 to receive a breast cancer screening every few years. She walks us through the most commonly asked questions about early detection.
It really is an individualized conversation with your healthcare provider, and it depends a lot on your family history, sort of what other health information that you have. Generally, the options include a mammogram, a breast ultrasound, a breast MRI, and then also a clinical breast exam, which is a comprehensive breast exam with your healthcare provider. All of those are screening tools, and depending on what your individual health situation is, your provider will kind of help you understand what the best options are. So oftentimes people ask, when should they start mammograms? When should they start screening? And when we talk about like a clinical breast exam, that is something that women should be getting every 1 to 3 years after age 20. As you get older, you definitely should be getting a clinical breast exam at least yearly. When you talk about other testing, so specifically mammograms, which are considered the gold standard, oftentimes women want to know, when should they start those testing? And again, I think having a conversation with your healthcare provider is going to be the best option. But things to weigh include sort of what are the risks of a possible false positive, right? So, anytime that you're doing a screening test, there are going to be false positives and false negatives, meaning that tests that miss out on a diagnosis, and then sometimes your things that are found that actually are not breast cancer, and that may require you having a biopsy done, which can include its own risk of complications, the anxiety associated with that. So just making sure that you understand what those risks and benefits are for your particular situation.
Okay, I want to go to the phone lines right now. We have Natasha on the phone. Natasha, thanks so much for joining us this evening. What's your question?
Yes, thank you guys for doing this. My question is, how do we encourage our male partners to seek out that medical examination? And I thought it was pretty alarming that it's 1% of men, but should they go and get examined as women should, or once something is alarming in their bodies, then pay attention to it?
Yes, so currently we don't recommend regular screening for men for breast cancer because it's so rare, but we definitely want them to be breast aware just as women are. So if they notice a change to their breast, their chest area, under the arm, we want you to help encourage them to go to the doctor. Sometimes we know it's difficult for our male partners to want to go and see a physician. You can always point out to them that you go faithfully every year for your clinical exam and mammogram and set a good example so that if he notices a change, then you can encourage him to do the same.
So important to encourage men, because sometimes we know men, and sometimes women too, sometimes they shy away from going to the doctor for any reason. Natasha, thanks so much for your call this evening. We've talked about the causes of breast cancer and early detection, but now let's shift our attention to what happens after a cancer diagnosis. Dr. Ullman and Dr. Falkenberg, you can both explain the different treatment options. Dr. Ullman, we'll start with you. Tell us a little bit about surgery options.
So in general, women have two choices when it comes to their surgical treatment for breast cancer. One is something called a lumpectomy, where we go in and target the tumor, take a little extra tissue around the tumor, make a cube, sometimes a little bit extra to make sure we've cleared it out. And then oftentimes that's partnered with radiation, which my colleague Dr. Falkenberg can tell you more about. And then the other option is mastectomy, which is removal of the majority of the breast tissue. We can't get every cell, but we try to do our best, where we're removing the breast, and that can either be paired with reconstruction, or some women choose to go flat after a mastectomy and use a prosthesis. So the lumpectomy with radiation or the mastectomy, it's important for women to know that no matter which surgery you choose, in general, your overall survival is the same. So surgery is just a tool to help get the cancer out, and then the other treatments help you live a long, healthy life.
Dr. Falkenberg, staying on the topic of treatments, here's another question. Do I have to get both radiation therapy and chemotherapy?
So that all depends upon the final pathology. If someone gets a lumpectomy, just as Dr. Ullman discussed, then radiation is necessary after a lumpectomy. And sometimes radiation is necessary after a mastectomy as well. If someone has positive lymph nodes or a large tumor, then we still need radiation even after a mastectomy. Chemotherapy depends much upon the size of the tumor, the number of lymph nodes, and also the pathology. There are multiple types of breast cancer, from triple negative to triple positive to estrogen positive to estrogen negative and HER2 positive. So that is to be discussed with the chemotherapy doctor and make decisions regarding the best treatment options for the patient.
Another commonly asked question, will I be radioactive after receiving radiation for my cancer?
Thankfully, patients are not radioactive after receiving radiation for breast cancer. Radiation for breast cancer is given through external beam radiation or photon therapy. It's high energy X-rays to the breast. So it's very tolerable for the patient, and they will not be radioactive or glow in the dark afterwards.
Well, something else that may be on the minds of many women diagnosed with breast cancer, will I go into early menopause because of the cancer or the treatment? Dr. Ullman?
From the surgical side, it does not put you into early menopause. Some of the medications that we do use, such as chemotherapy agents, are the ones people think about where we put it through an IV into your arm. That can put you into early menopause. So it really depends on the type of cancer you have, the type of treatments that you have, and it's a discussion that you need to have with your medical oncologist.
This question is for Dr. Falkenberg. Going hand in hand with menopause, will breast cancer impact my chances of getting pregnant?
Well, chemotherapy, as Dr. Ullman alluded to, can put patients into menopause, and so therefore they would not be able to get pregnant after that. We do not advise women get pregnant while they are on a medication called tamoxifen, and so that would be something to discuss with the medical oncologist about wanting or desiring fertility in the future. That's very important for many young patients, and we do have young patients that get breast cancer that go through chemotherapy. So there are options for those young patients.
And what about breastfeeding? Do you ever see women who are diagnosed with breast cancer while they're currently breastfeeding?
Yes, we actually do see that. That's pretty rare for patients to be diagnosed with breast cancer while they're pregnant or while they're breastfeeding. We have patients that have a mass that develops during pregnancy, and of course, many times they think it's just because they're pregnant. I strongly encourage all women that notice a new mass or something abnormal while they are pregnant or breastfeeding to seek care from their physician.
Yeah. Well, according to the American Cancer Society, 6% of women diagnosed with breast cancer have cancer that spreads outside their breasts. Dr. Ullman, tell us what it's like if the cancer spreads from a surgical standpoint.
Typically, once the cancer spreads outside of the body, surgery is not the best option for them. Usually at that point, we refer to medical oncology for chemotherapy and some newer options as well, immunotherapy that targets the specific type of cancer that a woman has. Surgery is usually reserved in those cases for masses that grow large, painful, or are bleeding, and it's really a palliative procedure at that point, not curative.
And Dr. Falkenberg, what can you tell us from an oncologist's perspective?
Cancer that spreads outside the breast is treated with systemic therapy, chemotherapy, or hormone blockade, and radiation can be used in that instance for pain control or for other local control issues.
All right, so I have a personal question of my own for both of you. Now, when I was in my 20s, my doctor found 3 lumps in my left breast. I had a biopsy. They were all benign, but the doctor recommended surgery as a precaution and told me to take a little time to think about it. And while I was thinking about it, I decided to get a second opinion. And during those exams, that doctor discovered the lumps were no longer there. So they had disappeared, dissolved. I don't know, I call it divine intervention, right? But how often does that kind of thing happen? Is there a medical explanation? I'm sure there is, right? But would you recommend surgery if a woman does not have cancer?
So we do surgery for benign lesions of the breast. In your case, it sounds like you may have had something called a fibroadenoma, which is a benign mass of the breast. I actually had them as well when I was younger. Surprisingly, they can both grow and they can shrink back down. Mine on my mammograms that I've been getting every year seem to have been shrinking, which is similar to your story. For other women, they grow and become more painful. Typically, we look for them to become a certain size or be causing pain or irritation or discomfort wearing bras before we discuss doing surgery with the women that have them. But we do surgery for benign masses of the breast, but again, under special circumstances.
Thank you for enlightening me. And for our last most commonly asked question, we want to go to Dr. Ullman again. What should I tell my employer after my diagnosis?
So you don't have to disclose your diagnosis unless you want to with your employer. That is protected information. But if you talk with them, let them know that you may periodically be missing work. For example, for surgery, usually there's a shorter recovery period for lumpectomy, sometimes 1 or 2 weeks, depending on your job. Mastectomy plus or minus reconstruction, typically you're looking more at 4 to 6 weeks. A lot of women do well after surgery and recover. And then with radiation, I'll let Dr. Falkenberg speak to that, but I've seen a lot of patients work through radiation.
Many of my patients are able to work through radiation. We have patients that do regular exercise during radiation. We have patients that take care of children or other family members during radiation. So it is tolerable, though some people do have some fatigue. So I think definitely talking to someone at work if you find that necessary, and maybe taking off work only when necessary. Sometimes working through breast cancer treatment actually keeps your mind off of treatment, and most of my patients like the normalcy and to feel normal every day.
Okay. We want all of you at home watching right now, online with us. You are not alone. Having a support system after receiving a cancer diagnosis during treatment and even into remission can help provide some relief. There are several support groups across North Alabama. This includes Bosom Buddies, Clearview Adolescent and Young Adult Cancer Program, Pink Sisters, Pink Ladies, and Circle of Friends. We have a full list of the dates and times the groups meet on our website right now at waaytv.com. And there are also ways for you to help a loved one going through treatment. Experts say educating yourself about the specific type of cancer and supporting your loved one's treatment decisions are the top 2 ways to show support. Well, they also are recommending listening, giving advice only when asked, and staying connected with both the person with cancer and their caregivers. Dr. Ullman, Dr. Falkenberg, thank you both so much for being here with us tonight. And for those of you watching online, be well, and thank you for the privilege of your time. Before you go, we leave you with this.
Breast cancer is very common, and while there are some things that you can do to prevent it, the most important thing is going to be early detection. So making sure that you're keeping up with all of your healthcare screenings and those sorts of things really does improve outcomes. Generally, the survival for breast cancer, the 5-year survival is about 90%, which has improved a lot over the last few decades. And so, definitely have those conversations with your healthcare provider before you have a situation where you have a mass or that sort of thing, and make sure that you are familiar with the signs of breast cancer. So, we talked a little bit about breast self-examination. You're looking for masses or any kind of lump, any skin changes, so retraction or dimpling in the skin. If you're having nipple discharge, those are all things you want to come to your healthcare provider as soon as possible with.